A few weeks before each clinical experience, the clinical instructor and center coordinator will receive a student packet in the postal mail. The first form in that packet is the Guide to Clinical Education forms for the clinical instructor. I'd like to take a quick moment to review the forms for the clinical experience and how they are completed. Beginning with the forms completed by the clinical instructor. The easiest way for us to review these forms is within the Clinical Faculty Resources Center. And here we are within the PTA program Clinical Site Manual. And I'm going to scroll down to the forms completed by the CI during a clinical experience. So the first form that needs to be completed is the clinical instructor profile for PT education. This is a joint form designed by the URI PT program as well as the PTA program at CCRI. It was designed so that clinical instructors could fill it out once and use it for both programs. It is good for 2 years once it is completed. The profile should be completed and sent back to CCRI prior to the start of the clinical experience. It's a 2-page document. There's a mailing envelope provided in the packet, so once it's completed, it can go right back in the mail to CCRI. The next document is the Student Performance Evaluation. Going back to our site manual, we see our Student Performance Evaluation document here. So the Student Performance Evaluation is designed to be completed by the clinical instructor at the midterm and the final of the clinical experience. I have a separate video tutorial that will review the grading scale for the Student Performance Evaluation as well as a brief review of some of the grading criteria. I would encourage you to take a look at that video as well. The next form that needs to be completed by the clinical instructor is the CI evaluation of CCRI's clinical education program. We value your feedback about our program and ask that all clinical instructors complete this brief evaluation form at the end of the clinical experience. There is a different version of the form for all 3 clinicals. In the student packet, you will see the correct version of the form. For our purposes of demonstration right now, we'll look at the evaluation of the ClinEd program for ClinEd 1. And you'll see this relatively brief form asks you to provide us with feedback about the clinical education program at CCRI, about the ACCE, who coordinated the experience for you, as well as the course coordinator. And the course coordinator is the individual who contacted the CI at the end of the first week to check the student status, who came out to do the midterm site visit, who followed up with the student and CI if there was any issues or support that was required during the clinical. This form, after it's completed, we do ask that the clinical instructor seal this form in the envelope provided and give that form to the student on the last day of the clinical. And students will then hand deliver that completed form in the sealed envelope from you to the school so we can receive your feedback. So that takes care of the forms completed by the clinical instructor. Next, let's move on to the forms completed by the student with input from the clinical instructor. Our philosophy at CCRI is that our students are adult learners, and we really encourage and foster the students to take ownership of their own learning experience. In doing so, they initiate these next 2 forms, which really sets the goals for the experience and serves as a roadmap for the experience. We then like them to share those forms with you as the clinical instructor so you can also provide your input on these documents. The first document we'll look at is the final objectives for the clinical experience. So coming back to our PTA program Clinical Site Manual, I'm going to go down to my folder for the forms completed by the CI and the student together, jointly. So let's open up the final objectives document. And what you will see here is that this document is supposed to be completed by the end of the first week of the experience. After the student has become oriented to your facility, has a better understanding of the caseload, some of the special experiences that they might have the opportunity to participate with, and to set some long-term goals, some final objectives for themselves in terms of what they think and you think that student should look like by the end of this clinical experience with respect to caseload in your particular facility. Caseload goals are not something that the college can set. Depending on the setting, caseload can vary widely. In an outpatient setting, orthopedic setting, we would expect a much higher number of patients seen per day than we would expect to see on an inpatient rehab unit where clients are treated BID. So the caseload goals really are very facility specific, and we ask that the student with your input sets a goal for caseload. Any other specific interventions that might be specialized to your facility, the degree of autonomy that you would expect to see the student functioning with in your particular setting, and that takes into account, of course, the complexity of your patients. Administrative duties in terms of billing, documentation, communication with patients and other disciplines, if the student might have the opportunity to report at rounds or have other interdisciplinary experiences. Goals for those types of things should be incorporated on the final objectives for the clinical experience form. And again, the student will initiate this at the end of the first week and provide you with their initial take on the goals, and then you can provide your additional input to them. Once the final goals for the experience are set, the student is requested to fill out a weekly planning form as well. So the weekly planning form, we ask the students initiate this on Thursday night every week, that they go home and write up a brief review of the week, and that they write goals for the upcoming week. So these basically serve as the short-term goals to help them incrementally make progress toward those final objectives that were set on week 1, as well as any other technical performance areas in terms of treatment delivery skills or data collection that they might be working toward. So the students should set several goals for themselves on the weekly goals form. They should leave this form for you on your desk as the clinical instructor first thing on Friday morning. That will give you the chance to write a brief review of the week if you have anything to add that the student hasn't completed, to comment on any of the goals, make any revisions or additions that you see fit. I'll also bring your attention to the back side of the final objectives form and the weekly data form. They look the same. And this briefly reviews the components of a well-written behavioral objective. Our intention when we write goals for our students is that they're measurable, meaning we can at the end of that week or at the end of the experience say, yes, the student did meet it, or no, they did not meet it. So here's some components to pay attention to help the goals be measurable. And here's some helpful verbs that you can use as you're writing the behavioral objectives as well. So looking at the objective in terms of, is it a knowledge-based fact that the student needs to learn? That would be in the cognitive domain. If it's a physical performance item, something that the student needs to physically deliver a treatment, that would fall more in the psychomotor domain. And if the goal has to do with attitudes, feelings, even communication type of skills, interpersonal skills, that would fall in the affective domain. So the way these verbs are organized is that the left-hand column for all of these domains are the lower order skills. So the basic entry-level skills for the cognitive domain, for example, fall in knowledge base. As we move to the right up to comprehension, application, analysis, synthesis, and evaluation, the goals reach a higher order of thinking. Right? Same holds true with the psychomotor domain. On the left-hand side, those are our lower order skills. As we move up toward the right, the skill grows more complex. So these might be helpful verbs to use to start out the goals that are being written. All right, so that takes us through the forms completed by the CI and the student together. And the final category to look at are the forms completed by the student themselves. And I would like to go over these with you briefly so that you have a sense of what the student will be working on. These forms are not provided to you in the student packet, but copies are available online in the clinical site manual where we'll view them now. So starting with the student performance self-evaluation, come back out to our manual, and go down to the forms completed by the student. And here we see the student performance self-evaluation. This is the same document that you as the clinical instructor will fill out to rate the student performance throughout the clinical experience. The difference is here that the student's going to fill it out for themselves. So one of our philosophies is that the ability to accurately self-assess one's performance as a student and as a clinician is invaluable to help direct our future learning. And completing the self-evaluation gives the student a nice opportunity to calibrate themselves as to whether or not they're accurately self-assessing their abilities. And they do that by comparing the score they gave themselves to the score that was given to them by the clinical instructor. So as you review the midterm site visit form and the final performance evaluation with the student, we ask that you give the student their scores in a given area. Take, for example, professional behavior and attitude, which is the first section. And you give them their scores, and then the student has the opportunity to take out their self-evaluation, put that on the table and say, okay, and here's the scores I gave myself. If there's any areas of big discrepancy, that would be the time to have a discussion about where that discrepancy might have come into play and give the student some constructive feedback as to their score through your eyes. So again, they can calibrate their own self-assessment skills. So that is the student performance self-evaluation. The next thing that the student needs to complete are the checklist of diagnoses, interventions, and other experiences. Let's take a look at these now, starting with the checklist of diagnoses. So we at CCRI like to prepare our PTA students to be general practitioners, to have a broad exposure to many different patient populations, many different interventions, as well as other experiences. And these three forms provide us a mechanism to measure and make sure that our students are having a variety of these experiences throughout the course of their clinical education program here at CCRI. So the students are responsible to keep track of the various diagnoses that they've treated. They're broken down on this form into different diagnosis categories. For example, this is orthopedic surgical, and next we have straight orthopedic category, followed by neurological, and so forth. We've provided some diagnoses examples that fit into all of these categories, and there's also a space for the student to fill in any other experiences or diagnoses that they might have seen. What the student needs to do is to provide at least 3 different examples, and the thresholds do vary depending on the category, but in this particular category, provide at least 3 different examples in this category by the end of the clinical education 3 experience. So for some students, if they are working in an outpatient orthopedic setting, they might really take advantage, even if it's clinical education 1, of saying, I'm going to try and really make sure I get all of my orthopedic surgical exposures completed while I have this one clinical experience with this host of patients available to me. So we encourage our students to start acquiring these exposures as early on as possible throughout the clinical education program. At the end of the clinical experience, we ask that you as the clinical instructor sign this document verifying that the experiences the student notes that they have had exposure to have actually occurred. So here the student will note which experience they happened during. They'll give a brief description, if applicable, without of course including any identifying information on the patient. So that will help you to remember the patient and verify what exposure the student did have. So that checklist needs to be signed by you as the clinical instructor on the last day of the clinical experience. So that's the checklist of diagnoses. Checklist of interventions is set up much the same way, except for the intervention categories here are broken down according to interventions rather than diagnoses. So we've got therapeutic techniques, we've got other exercise techniques and equipment, and so forth. And again, the student is responsible to track their experiences. There's different thresholds set, how many experiences they need in each category by the end of the various clinical experiences. And at the end of the clinical, the student will come to you, and for any experiences, or in this case, interventions that they provided treatment for during that particular clinical, we will ask that you sign off on the form verifying that the student did indeed have that intervention experience. So you'll see that there's thresholds set on these forms as well. So for you as a clinical instructor to sign off and verify that the student did provide that intervention, the student must have performed it safely and effectively without physical or verbal cueing from the clinical instructor. Now that doesn't mean if the student had a brief question about planning before they went in to do the intervention, or they came to you for some confirmation afterward, that certainly wouldn't be a problem, but the student would need to, again, be safe and effective in the delivery of that intervention. And the final checklist is the checklist of other experiences. And again, set up much the same way, but here we have various other experiences. Here's modeling the essentials of the PT-PTA relationship, various interprofessional experiences, cultural competence, and so forth. So again, the student will be the individual responsible for tracking their experiences, initialing which clinical they experienced it during, and you will be asked as the clinical instructor to sign off on this at the end of the clinical. The threshold for the other experiences says that the student must be responsible for greater than 80% of the management of that particular experience from the perspective of a PTA, and they must be safe and effective in how they performed that particular, or participated with that particular experience. Those are the checklists, and the last form the student will fill out for us before concluding the experience is the APTA Evaluation of the Clinical Experience in Clinical Instruction. So this document has two parts to it. The first part is an evaluation of the clinical experience itself, and the student will provide feedback on the types of experiences they had while at your facility. And part two of this assessment is an assessment of the clinical instructor. So this form is available for your review online if you'd like to review the specific criteria. On the last day of the clinical, the student will ask you as the clinical instructor to sign off on the signature page at the beginning of this document, and the student is required to get your signature in order to successfully complete the experience. At the very end of the clinical, once all of this paperwork has been completed, what we ask is that the student take all of these completed and signed forms, and we have them put it in a large manila envelope that we provide for the student. We ask the student seal that envelope, and we ask that you as the clinical instructor sign over the flap of that sealed envelope to ensure that as the student delivers that information, hand delivers that information back to CCRI, that all of that information is just as it was when it left you at the clinical site. So that wraps up our review of the clinical education forms. So the program faculty is always available to you for any questions, concerns, comments, feedback about the program, either in the planning phase or during a clinical experience. It's our job to be here to support you and make sure the experience is positive for everyone, so don't ever hesitate to reach out with questions.